Today on the Neck Rec, we'll be discussing your surgery time. So let's talk about it. And welcome back, everyone. I'm your host, Mike. And today's the big day. The day you decided to have surgery and you're going to have surgery. And I'll tell you right now, congratulations to you. There's been a lot of stressful nights, stressful days, a lot of sleepless nights, things that you've gone through to get to this point. And I'm telling you right now, it is going to be glorious that you're going to have this surgery. Now, if you did the right preparations like we talked about in the last video, which I will link in the description below, all you have to do today is go to the hospital, sit back and relax, and everybody's going to do everything for you. Now, a little bit of a disclaimer. I'm going to talk to you from the patient's perspective, not the doctor's. I'm not a doctor, nor do I play one on TV. So understand that if something during your surgical procedure doesn't go exactly like I'm describing mine, don't worry about it. Every surgeon's different, every situation's different. But what I basically want to do is give you a framework on what to expect when you go to the surgical hospital. And that's the first thing you're going to be doing, is going to a surgical hospital. Now, some people don't understand what a surgical hospital is, and let me explain that to you. Surgical hospital is basically where they perform surgeries of this nature. Normally, you will not go to a main hospital, as those surgery rooms are dedicated for those who are having life-threatening problems. So your surgeon will go over with you the location that you're going to go to. So don't worry about that. You'll know where to go. Everything's going to be great. And by the way, if you've never been to a surgical hospital before as far as directions are concerned, don't pick this day to figure out where you're going. Maybe do a dry one the day before. That way you don't have to worry about struggling getting directions on how to get there, so on and so forth. Remember, you want to make this the least stressful amount of time that you possibly can. So you've shown up to your surgical hospital. You're going to be asked to show up about 2 hours prior. So again, if your surgery is scheduled for 10, you'll show up at 8. Now let me tell you a little secret. You're not the only one there having surgery. So don't be alarmed if you walk into the waiting room and there's other people there. In fact, don't be even alarmed if you walk into the waiting room and you see other people that are going to be operated on by your own surgeon. Your surgeon has picked this day to usually conduct all the surgeries, and usually they'll do 2, 3, 4, upwards to 5 or 10, depending on the severity of the surgeries. So the good news is you've arrived, you've checked in. There will not be a lot of paperwork to fill out, as that's already been filled out prior to. Remember, they just want to get you there and get you relaxed. They'll soon call your name, and you'll head back to the back. Now, the back is what we call the surgical waiting area. That's when you go in, and if you listen to my prior video, you're wearing your nice, loose, comfortable clothing, and you're taking it off and doing what I consider the most challenging part of this whole procedure, and that is putting on that surgical gown. Now, let me tell you a secret. If it's opening to the back, you're good to go. If you're feeling a breeze to the front, you might want to reassess the situation and make sure you put it on properly. You'll get it on, you'll sit in the bed, relax, and the nurse will come in and take care of your business. Now the nurse will take your vital signs, make sure you're good, check your temperature, so on and so forth. But the most vital thing they'll do is they'll establish an IV, because that's where all your medications are going to be given, is through your IV. So once that's established to you, and a lot of people think, well, Mikey, is that a process that's going to hurt? No. In fact, I had an IV that was given to me in my hand, and they were very nice. They'd given me a shot of lidocaine beforehand. I didn't even feel the needle go in, so you won't even worry about that. So you're sitting there, your IV's established. You'll probably be allowed to have a loved one come back, sit down, have a little discussion with you. And soon after, your surgeon is going to show up to make sure all your questions are answered. Now again, a lot of people have asked about my surgeon, Dr. Neil Shaw. Well, I'll give all that information in the description below in case you missed it in my last video. Again, an outstanding surgeon did an outstanding job. But he's not there to answer all the intricate questions. Those were taken care of prior to. He's going to basically ask you, are you ready to go? You're going to give him a thumbs up, and he or she is going to take care of business for you. Now, the next person you're going to visit, depending on the situation, is what I call a neuro advocate. At least it was in my case. This was a person who's going to sit down and monitor your brain function while you're under anesthesia. If that person feels like that there's any issues at all, they're going to stop the surgery, bring you back out, and take care of your business. Now again, I didn't have any issues, but it was a good feeling knowing that I had a person that was watching out for me to make sure everything was going well. Now the last person you're going to see is the person I call the magic man or the magic woman. This is your anesthesiologist. Now this person is going to come in, introduce themselves to you, and let them know what he or she is going to do through the process. And normally you're not going to have any questions of this person, But this is a vital person because this person is going to make sure you don't remember a thing during the surgical process. If you're ready to go, normally he or she will have a needle in their pocket. They'll bring it right out and they'll give you a shot right in the IV. And I'll tell you right now, this shot is what I call the magic juice. If you were a little apprehensive, a little stressed beforehand, all of that is going to disappear. And for those of you that have had surgery before, you know exactly what I'm talking about. And by the time that they wheeled me back to the operating room, which was just a short trip down the hallway, I was feeling good and I was not worried about a thing. And don't be surprised if they ask you some goofy question about who's your favorite baseball team or your vacation spot. All they're doing is getting you talking for a few seconds and see how you're responding as you go under the knife. And once you're comfortable with the anesthesiologist and the surgeon, they're going to get started with your surgery. Now, what to expect then? Well, they're going to go in through the front of your neck. That's right, the front of your neck, not in the back. And they're going to give it an incision right here, and they're going to gently move your esophagus aside to give them room to get to the back of the neck area where your cervical discs are located. And depending on how many you're going to have replaced, they're going to start the process of removing those discs. And they're going to take their time. The surgeon's usually looking through a microscope and taking several x-rays during the process to make sure that they're doing exactly what they're supposed to. All the bad disc is going to be removed, and then they're going to insert the artificial disc in your neck, make sure that that is seated properly, close you back up, and bring you right back out of surgery. And it's just that simple. Now, when you come out of surgery, you'll be a little groggy, but this is where you really need to communicate with your nurse at the location. The only issue that I personally have, and many people have talked to me about it, is the anesthesia makes you a little nauseous. And if that is the case, make sure you tell your nurse. Because if the nurse knows, all it is a simple shot in the IV that we talked about earlier, and that will take it away completely. Then you'll go into observation for about 2 to 3 hours, and if you're responding well, they're going to put you in a wheelchair and wheel you back out. Now remember, you'll need to have a loved one take you home because most facilities will not allow an Uber to do so. So make sure you've made arrangements to take care of that. So you arrive back to the house, you walk right back into that comfy chair or that comfy couch that we talked about in earlier videos, and then your job is just to sit back and relax. Remember, all the preparation has already been done. Now, the only thing that you really need to pay attention to the first couple of days is make sure you get up and walk around. And your surgeon or maybe a physical therapist at the location will tell somebody there, including yourself, get up and walk around because they do not want to have any blood clots in your legs cause you any concern. That's the first thing that they want to do. The second thing is if you can get up and walk around a little bit, it starts the circulation process in the body to heal and get better. So that's basically it in a nutshell for what your surgery is to be expected. Now in the next video, we're going to talk about your 2-week post-operative visit and what to expect from that. And if you like this video, consider giving it a thumbs up and also subscribe to the channel. And I thank you very much for tuning in, and we'll see you on the next one.